My involvement with snakebite research started in 1993. The reason why I chose to do snakebite research because I saw snakebite morbidity and mortality due to snakebite is highest in Sri Lanka, which was recorded in the Guinness Book of Records in 1990. So I was thinking very hard, and I was thinking, how can I reduce the snakebite morbidity and mortality in Sri Lanka? So, and we do not have a strong statistics about snakebite research in snakebite morbidity and mortality in the hospital sector. So I started on a research and higher degree, master of philosophy degree on snakebite research, clinico-epidemiological study on identified snake bites in the hospitals nationally from 1993 till 1995. And that research really resulted in various clinical syndromes of different snakes. And this was really, we were able to make an algorithm out of my research, where when a patient comes with a snake bite, without knowing the snakes which was identified from the clinical effects, we were able to guess what is the likely snake, and that algorithm for identifying snakes in snake bite was also adopted in the CRO snake bite guideline, snake bite management guidelines in 2016. And we were able to produce a lot of manuscripts for journal articles. In the meantime, it was earlier recognized the Sri Lankan rhesus viper is different from the Indian rhesus viper in the venom composition. And we also recognized there is a geographical variation in the snake venom which causes different clinical picture. And that has an implication in the management of snake bite in Sri Lanka due to rhesus viper bites, because in Sri Lanka we do not manufacture our own indigenous antivenom, and we get down the antivenom from our neighboring country India, and they produce the antivenom by using the Indian rhesus viper, Indian common crate, Indian cobra and Indian saw-scale viper, and it's a polyspecific antivenom. So when we use this Indian antivenom to treat our patients with, especially with rhesus viper bite envenoming, we have to use massive doses of a snake antivenom and to neutralize the venom. And in 1985, under the leadership of Professor David Worrell from Oxford and Professor David Theakston from Tropical School of Medicine, Liverpool, and late Dr. Dennis Aloysius, there was a team. They did a research in Anuradhapura where the snake bite is more common, and they found that even after treating the patients, even after weeks and months later also, they were able to identify the venom in the patient's blood. So that means that it was not neutralized by the Indian antivenom. So with the effort of the University of Oxford and the Tropical School of Medicine, Liverpool, and University of Colombo, we had a research group called Colombo Research Group. With the effort of this research group, we finally produced a monospecific antivenom against Sri Lankan rhesus viper venom, and it was called Polanga Tab by the help of the Therapeutic Antibodies Incorporation. And there was a very first clinical trial which was done in Sri Lanka in 1995 to 97. We did the dose finding study, then we did a randomized comparison trial between this new monospecific antivenom versus the existing polyspecific Indian antivenom, and we showed this monospecific antivenom neutralizes very quickly as well as less side effects. In the meantime, in order to produce the indigenous antivenom, the University of Colombo embarked on a snake venom research laboratory and herpetarium in the Faculty of Medicine in 2003 under the great work of Professor Rizvi Sharif. And in this laboratory and herpetarium, we have the snakes, and we look after the snakes, we milk the venom, and we are trying to produce still an antivenom for Sri Lanka, which is indigenous, and we will be hoping there will be less side effects and less reaction, and we will be able to treat them with less dose of antivenom. I'm involved in health education as well as community education on prevention of snakebite, as well as how to do first aid treatment when they are bitten by snakes. And I'm one of the members in the Snakebite Expert Committee of the Sri Lanka Medical Association, as well as we have prepared national guidelines for the management of snakebite. And we have really, I have been an instrument in preparing a book called Snakes, Fascinating Creatures in English, as well as it was translated to one of our local language called Sinhalese, the same book which is written for the general public, about first aid, how to identify snakes, what are the symptoms of snake bite, and when they are bitten by snake, how they should come to the hospital, and little bit about the management of snake bite. And this is for the school children, general public, and everybody to educate them. Thank you.